Welcome back to another episode of the Living Well podcast. I'm Carly Williams.
And I am Jessica Lopez. Today we're diving into a topic filling our news and social media feeds: weight loss medications. We're thrilled to have Dr. Janine Kyrillos, the director of the Jefferson Comprehensive Weight Management Program, here to talk about this trending topic.
Dr. Kyrillos breaks down the different weight loss medications, explains exactly how they work, and discusses what it really takes to achieve and maintain healthy weight loss. The old eat less, move more method is not it.
With that, let's get into our conversation with Dr. Kyrillos.
Hi, I'm Dr. Janine Kyrillos. I'm Associate Professor of Clinical Medicine at Sidney Kimmel Medical College of Thomas Jefferson University and Medical Director of Jefferson Comprehensive Weight Management. I'm board certified in both internal medicine and in obesity medicine, and I'm an internist who specializes in weight management and taking care of patients with excess weight and obesity. I'm so happy to be here today.
The topic of today's podcast is all about weight loss medications. A good place to start might be talking about why do so many people struggle with weight loss?
The way that I explain it to patients is that our bodies weren't designed to live today. We were designed to live hundreds of thousands of years ago in the Stone Age, where you had to go hunt and gather, and our bodies are designed to hold on to food, to prepare for famine and starvation. But now we haven't evolved as quickly as the modern food supply and the environmental factors that we have today, and the stressors and medications, and there's so many things that are happening now that our bodies have to assimilate, and it's just overwhelming our system. And so that's why you're seeing more and more of the population struggling with excess weight, because our bodies are doing what it's supposed to do. We're holding on to weight, creating insulation, getting ready for hibernation, but we don't live in the frozen tundra anymore. So it's difficult for us to manage now.
And can you explain how metabolism affects weight loss and why some people may find it harder to lose weight than others?
Metabolism is very complicated and complex, and our bodies want to defend a certain weight, defend a higher weight. And so our metabolism will adjust based on the external factors and the internal factors. So if we're not getting enough sleep, there are changes in our metabolism. If there's a lot of stress, the type of food we eat has a big effect on metabolism. We're learning a lot more that not all food is processed the same way in our system. If I eat, let's say, 100 calories of chocolate versus 100 calories of salmon and broccoli, my body's going to metabolize those very differently and have very different effects on storing the fat. We also have to look at the genetic factor in this. And you say why some people struggle more than others. Any chronic disease is basically genetics triggered by environment. So if you say somebody that has asthma, for example, it's their lung capacity and their genetic ability to breathe is affected by maybe the air quality or the allergen level. And why do some people breathe okay in certain situations and other people can't? And we don't tell them, oh, just breathe less so you don't wheeze as much. Obesity is the same thing. I might have the genetics where it doesn't matter. I don't eat very much at all, but I still gain weight. You might have the genetics where you can eat whatever you want and you don't gain weight. There's different ways that our bodies will react to the modern environment that's out there.
At what point should someone consider weight loss medications if they've been trying to lose weight and they aren't having success?
This is a tough question because in my world, I see such great success with medications that I feel like everybody could benefit, but we can't afford that as a society, and people can't afford it, and medications have side effects. The guidelines are that anybody with a body mass index, that's a calculation using weight and height, normal weight is 25 or below, and obesity is considered 30 or above. Overweight is 25 to 30. So people with a body mass index of 30 and above qualify and would benefit from medications, or people with a body mass index of 27 and above with an obesity-related condition, like hypertension, cholesterol, prediabetes, sleep apnea, things like that.
And I am just curious, what advice do you have for someone looking to lose 5 to 10 pounds?
I do ask their goals. What is it about that 5 or 10 pounds? When I see patients, I ask them, what is your, not what is your weight goal, but what do you want to see change? What is your ultimate goal? There are people that have health and metabolic issues that would benefit from 5 or 10 pounds. There are people that just feel better with that 5 or 10. And maybe they can identify behavioral patterns that they can tweak, looking at sleep and stress and activity and the quality of food. Maybe you can find a way to cut out that latte in the morning that's full of sugar, and maybe switch out a snack in the afternoon and have more protein and build behaviors that you can live better with. And if you lose 5 or 10 pounds, that's great. I wouldn't necessarily look at medications for something like that.
What are the most commonly prescribed weight loss medications today?
There are several medications that are approved for obesity treatment. The ones that you're hearing all about now are the GLP-1, the injections. Those are Saxenda, Wegovy, and Zepbound. But there are other medications. There are oral medications. I prescribe a lot of phentermine. Phentermine is an old-fashioned appetite suppressant diet pill. It's been around since 1959, so it's really tried and true. It has a little bit of a checkered history. Back in the 90s, it came out as fen-phen, and fen was taken off the market because of it caused heart valve problems. There was a lot of litigation. So phentermine became guilty by association because that other fen was taken off the market. It's a stimulant and it's controlled. So it's not as popular among primary care or people that are not comfortable prescribing it, but it's very effective and very cheap. But the most commonly prescribed, I would say, either the phentermine or these GLP-1s. This is very commonly confused among people, is that there are medications that are approved specifically for diabetes and then medications approved specifically for obesity. They are the same exact medications, but their brand names are different. So Wegovy is semaglutide that's approved for obesity. Ozempic is semaglutide that's approved for diabetes. They're the exact same medications. So medically, they're interchangeable. But in terms of insurance coverage and cost, they're different. So patients come to me and they say, oh, I looked at my plan and Ozempic is covered. And I said, well, Ozempic is covered, but only if you have diabetes. And your insurance plan is going to ask that. And if you don't have diabetes, I can't prescribe you Ozempic.
Can you explain how exactly these medications are working to aid losing weight?
So Wegovy semaglutide works on GLP-1, and tirzepatide, which is Zepbound, works on GLP-1 and another hormone called GIP. And these are hormones that control hunger and metabolism. Basically, you're sending an extra signal to your brain that you've already eaten, so you're not as hungry, you get full more quickly. They also have effects on digestion and how quickly your stomach empties, so it slows down your stomach so you stay full longer. They also have effects on the pancreas to control glucose and insulin metabolism, which has a big effect. And we didn't get into insulin resistance, but insulin resistance is one of the main drivers of fat storage and obesity. They affect on the metabolic level, the glucose and the insulin. They affect food appetite, reward, and signals that control hunger and satiety, and then they control the stomach emptying. That's what makes them so successful. They work on several different levels, where the older, more traditional weight loss medications really focus just on sort of one part of appetite. And if you think about, there are hundreds of signals that originate from our stomach, intestine, pancreas, and also our fat cells that communicate with the brain that control hunger and satiety. And you can kind of intercept some of those pathways, but the other ones will take over because, our bodies don't want to starve to death. And these medications affect several different levels of these pathways and overcome some of that metabolic adaptation. Metabolic adaptation is where your body changes its metabolism so that you store more food.
And along those lines, what are the other lifestyle changes that need to happen in order to have a more successful weight loss?
Really important. These medications are not magic. Some people can just take them and eat less. They can't tolerate as much food. And so they have the same things they were having before, but less. Those people don't do as well as people that also make deliberate changes in making sure they're getting protein and fiber, healthier fats, because in the end, our body still needs to be nourished properly. So if we're getting the protein and fiber and fat, our bodies will work with that. But if we're not getting it, and we're getting a lot of sugar and starch and things that are going to trigger our appetite more, then it's going to override the signal of the medication. And you're going to be hungrier because your body's going to be wanting more of those nutrients. Eating in a way that nourishes your body, protein, fiber, some fat, definitely works better with these medications. The flip side of that is that when patients are losing weight really quickly with these medications or after surgery, when you lose weight, you lose both fat and muscle. And really, you don't want to lose muscle, you just want to lose fat. You don't want to lose weight, you want to lose fat. And in order to maintain that, especially when you're losing weight quickly, you need to make sure you're getting enough protein to support that muscle mass, and also resistance exercise. You want to use those muscles and feed those muscles, or you're going to lose them. Making the lifestyle changes that support healthier, stronger body is really important. Lifestyle changes includes the food that you're eating, the nutrition, but also getting a proper sleep. Sleep definitely affects our hormones and our cortisol levels. And if you're not getting enough quality sleep, it can work against you. And activity is really important. And then looking at stress, things like that.
And are there any risks or side effects associated with weight loss medications, whether they're short term or long term?
All medications have side effects and potential complications. The way I explain it to patients is that they work to decrease your appetite and slow down your digestion. But if they work too well, then things can go backwards. You can start having some nausea, reflux, even some vomiting, some other gastrointestinal symptoms. Some people diarrhea, some people constipation. Some people will get some fatigue or headaches. I think a lot of side effects are related to dehydration because you're not drinking as much. Some people don't have that same thirst signal that they used to. So with the dehydration, you can get more fatigue, heart racing, some dizziness. We make sure that patients really know to stay very well hydrated, drink plenty of fluids. There is a black box warning for a certain type of thyroid cancer called medullary thyroid cancer that actually was only seen in the rodent studies in the research trials. It hasn't been reported in humans, but it is an absolute contraindication if a patient has a personal or family history of medullary thyroid cancer for all of these medications, these injectable medications. And I also want to add, there's a lot of things in the media, in the newspapers and social media about stomach paralysis and really extreme side effects from these medications. A lot of that is very sensationalized. And the first thing to know is you don't really know what people are taking and how they're taking it and are they taking it properly. There are a lot of compounded medications that are out there. Because these medications, there's shortages of semaglutide and tirzepatide, there are a lot of independent pharmacies and entities that are creating these molecules themselves that are not necessarily the same exact molecule as the one that's been studied and FDA approved. And they can mix them with different things, and there's really no quality control. I mean, it could be somebody in their basement with their chemistry set that, there's not a lot of regulation. And so a lot of these side effects that you hear about may not be related to these brand name medications, or the way that we're being prescribed properly. So be careful what you hear and what you listen to, and know that there are tried and true studies looking at these, and the side effects are much more rare than you think about.
And how well do those medications work?
So the GLP-1 meds are very robust. In the studies, semaglutide on the highest dose, patients lost 15% of their body weight. With tirzepatide, it was 21% at the highest dose, and some studies show even more weight loss. We see some people don't lose as much, but we see a lot of people that lose more than that. But if you're looking at 15%, so let's say you weigh 300 pounds, 15% is 45 pounds. That's a great result in looking at improvements in metabolic health and physical health and well-being. But it may not be enough to get a knee replacement, or it may not be as much as somebody had hoped for, but it really is an amazing amount. So back to realistic expectations. I had a patient yesterday that lost, I think, 25% of her weight.
Wow.
And she was doing great, but her body mass index was still like 30, in the high 30s, like 36 or 37. And she said, I'm not losing any more weight. What can I do? And I said, well, this may be where your body levels out. Your body's leveling out at a place where you can sustain long term, where this medication is giving you the support it's going to give you. And this may be enough. So in terms of how much weight somebody can lose, it's very individual, and it also doesn't have to be all of their weight and get down to a normal body mass index.
And about how long does it take for someone on medications to get to that 15 or more percent?
Those studies were looking at a year, but we do look for 5% at 3 months. 3 months from their target dose. So these medications have titration where every month you have to increase the dose, and that can take several months. Once you're at the target dose for another 3 months, that's where we want to see at least 5% weight loss.
And then it gradually decreases, the doses gradually decrease?
No, we stay at whatever dose that they got to that was working the most. that was the most beneficial. Another big question I often get is how long do we continue these medications? And the answer is that obesity is a chronic disease and it requires long-term treatment. So if you're taking a medication to control your blood pressure and now your blood pressure is normal, your doctor doesn't tell you, oh, okay, well, you can stop your blood pressure med now because your blood pressure is going to go right back up again. It's kind of the same thing with weight loss. If this is what made the difference to help you make changes and to help your body maintain a lower weight and you take it away, people do tend to regain weight. And I do have long-term patients reach a settling point where they feel pretty confident and their weight is fairly stable. We may try to wean or stretch out the dosing. And officially, the recommendations are to continue the same dose long-term, but I do have some patients that will stretch it out or wean or do it a little bit differently. But as soon as the weight starts to creep back up again, you tighten it back, you bring it back on. Don't wait until you've gained a lot of weight back.
Is there anything else patients should know once they begin taking weight loss medications that we haven't already talked about?
So some things that happen a lot with our patients, the dosing of these medications is very complicated. You can't just start at a high dose. Your body won't be able to tolerate it. You'll be sick and you'll get all those side effects. You have to slowly introduce it to your system. So every month you increase the dose. But sometimes a patient will get the first 2 doses and then there's a shortage and they can't get the next month's dose, or their insurance changes, or life happens and they don't fill it in time. And so maybe 2 or 3 months go by and they're like, okay, I'm going to go back to dose number 3 now. You can't go right back to dose number 3. You got to start at the beginning again. If there's any interruptions, more than 2-week interruption, then you have to talk to your clinician about how to restart. A lot of times they'll be admitted to the hospital for some reason, or they'll have a surgery and the dose has to be held. You can hold it for up to 2 weeks. Beyond that, make sure you check before restarting.
What evidence-based recommendations would you suggest for people looking to lose weight without using medications or surgery?
The mainstay is lifestyle changes and all the things that I talked about: sleep, stress, activity, and then the quality of the food. We're really moving away from the calorie counting and restriction. The old eat less, move more actually has not been shown to be beneficial. And you can see everybody tries to eat less and move more, and it's very difficult. And it sets your body up for that kind of restriction, ends up backfiring. Metabolism slows down, people get hungrier and they can't maintain. But if you change the quality of food so that you're eating food that doesn't trigger your blood sugar so much, that keeps your blood sugar more even, is nourishing your body in a consistent way, that's how you're going to be able to make changes long term. I also want to mention activity and exercise. They're really important for health, energy, strength, flexibility. But again, this is not a calorie count. It's not just eat less, move more. The old thing, you can't outrun a bad diet, so to speak. I don't like the words bad or diet, but you can exercise all you want, but if you're not changing other lifestyle components, the studies are pretty clear that exercise alone makes it very difficult to lose weight. However, exercise does help maintain weight. If you're used to being active and health and exercising, it prevents weight gain. And so if you've lost weight through lifestyle, through other measures, and you add the exercise, that'll help you maintain. If you stop that activity, then you may gain weight. So people that have an injury and suddenly can't exercise as much or change to a more sedentary job, they may gain weight. But unfortunately, they can't just turn around and run it off again.
I was wondering if you could talk a little bit about the term learned helplessness when it comes to losing weight.
The traditional approach was go on a diet, eat less, lose weight, and you have to lose 100 pounds. So think about that. You try so hard. You try to eat less, you try to exercise, maybe you lose a little bit of weight, but then your body starts to adapt and say, oh, no, no, you must be going into starvation mode. Let me slow down. Let me make you hungrier so that I can get that weight back. And it's almost impossible to maintain large amounts of weight loss. So if I have obesity and I'm 30, 50, 100 pounds overweight, and you tell me I have to lose 50 pounds and then don't give me any tools, I'm going to shut down. I'm not going to listen to your advice. I'm not going to even try anymore. I'm going to just say, forget it. I'm just going to eat what I want because it doesn't even matter. That's something that we really try to help people understand, is eating in a way that works with our metabolism and physiology, and that is satisfying, that they feel nourished, that they don't feel deprived and restricted.
What would be one realistic goal that anybody could do, like one small step if they wanted to lose weight?
Look at what you're drinking. Look at the juice, the soda. Try not to drink calories. That's a big place where people are seeing all these energy drinks and the mocha latte coffees. See if you can switch out to sugar-free versions, drinking more water or seltzer. That's a really great place to start for a lot of people. And the other thing is looking at your breakfast. Traditional breakfast foods are filled with sugar and starch, cereal, toast. Patients will come and they say, oh, I have a very healthy breakfast. I have bran cereal with banana and orange juice. It's actually a terrible breakfast. And you're starting off your day triggering your blood sugar so that you're going to start this blood sugar up and down roller coaster. Look at eating more protein, protein before anything else.
Be sure to check out the show notes for additional resources, including the link to the Living Well blog where we publish full episode transcripts.
And as always, if you enjoy our podcast, we truly appreciate a rating on Apple, Spotify, or wherever you listen to podcasts. The full podcast episodes are also available on our YouTube channel at Jefferson Health.
Production support for today's episode provided by Brittany Raflak and Barbara Henderson. We're your hosts, Jessica Lopez
and Carly Williams. Be well.